My name is Dr. Rick Seguil.
And action. Hey, Jay, how did this is Kirk And action. Hey everyone, Steve had a question on sinus headaches. I'm Dr. Rick, and this is Herbal 41, a mini clinic. So, sinus headaches. I did do a video on stuffy nose, which kind of leads into sinus headaches. At least I think the number one reason for headaches like this. But if this is the first time you're finding me, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So, sinus headaches. Well, I'm just going to group a whole bunch of things under sinus headaches because everybody kind of knows anything up here as being a sinus a headache. But there's many different things that cause pain to the face. Now, there's typical rules of thumb when we as doctors try to figure out on the phone or in the office about headaches. Most important for older people would be to rule out the transient ischemic attack or a stroke. That involves brain tissue. But honestly, it's usually very rare, and we have algorithms in the emergency room now that get that thing taken care of fast, almost like a heart attack. So hopefully we can reverse the damage quick. But the most common thing for a headache is going to be a sinus problem. Sinus congestion in the form of inflammation, sinus infection in the form of a true sinus infection. That means that sinus cavities are infected, or an allergic response, which is kind of like inflammation, but you can have swelling without allergies. I'll explain that in a second. Actually, let's go ahead and do it now. So I want you to check out that other video I have on the stuffy nose, and it'll take care of a lot more explanation here. But this is a front view like this, and this is a side view like this. Pretty good, huh? So this front view, you're looking at somebody straight on. I kind of drew the eyes right here, but these black things are the sinuses. These are the maxillary sinuses that are right here. These are the frontal sinuses that are right here. And behind, these big guys are more sinuses. They're called sphenoid and ethmoid, but they're kind of in the back. If you're looking from the side, frontal's here, maxillary's here, and sphenoid and ethmoid are back here. These guys are the biggest problem. They're the biggest pain in the butt because they're the most superficial and they can cause pounding. They also get clogged up a lot. So the way these sinuses work is that the sinus is a cavity. It's a hollow part of the skull in order that we don't have such a heavy skull. So there are empty pockets in the skull that are important for keeping the light load of this heavy bowling ball, but they also feed into the nasal passage. And the way the sinus is empty, like a cave with one way in, one way out. There is a lining in here, and the lining is live. It secretes mucus, and the mucus is supposed to be a little bit at a time. Any mucus that develops here, or in the two back here, that's supposed to drip down via this spout into where the nose is. This is the nasal passage. These three little shelf-like structures are called conchae, or concha, and they just increase the surface area of the nose so that when you take a deep breath in, the air passes through these areas and you can get to smell things. You get to filter stuff before it gets to go down into the lungs. So on a side view, this way, air goes in my nose and it passes through these shelves and it goes down into the lungs. So the shelves act to, number one, warm, number two, filter, number three, it causes turbulence so that these little nerve endings up here will get to smell will get to sense what's going on in your environment and get different odors for different experiences. So the problem is we have a lot of irritants in the air and in our environment, in our food, that make these guys swell up a lot and produce a lot of mucus. And we're in Chicago, and even if you don't have allergies, like I mentioned, and most people have allergies to mold, dust, and ragweed, at least have a little bit of a reaction. Some people a terrible reaction. So when you breathe in a little bit, even if you can't see it in the air, then even a little bit will cause the nose to swell, the eyes to get itchy, the chest to have phlegm, or the worst case scenario is an asthma attack to turn on. So that's how the lining of the sinuses, the lining of the sinuses here is contiguous with the lining of the nasal passage, and that's contiguous with the lining of the chest. So When one area is flared, the other areas will respond too. So if you have an asthma attack going on, you'll probably have a swollen nose. Or backwards, if you have a swollen nose going on, you'll probably have an asthma attack trigger fast. So you can't really remove one from the other. It's like having poison enter the mouth. The whole digestive tract will react to that poison. The stomach, the small intestine, and the colon. That's why you have diarrhea down below from a poison up above. So they're all contiguous. So the problem is how to tell the difference between an allergy, and usually you'll have the associated symptoms. So you're going to have a headache here, but you'll have probably itchy eyes, watery eyes, clear nose discharge, and postnasal drip. Like me, that reason I have to go is because my throat's a little dry, and I probably have a little postnasal drip, for which I use a neti pot. This is a neti pot. I put it in this side, and it comes out the other side, and it rinses out some stuff. It doesn't rinse out a lot, but it does work as a gentle rinse. So when you put a neti pot in, to get rid of the allergens in the air, you put it in this side, and you tilt it up. It kind of goes around, goes to the other side, and it comes out the other side. And it only takes care of the lower. It doesn't take care of the upper. Some people, they probably turn over too much, and then all the fluid goes to the olfactory nerves. That's irritating. When you expose these delicate olfactory nerves, which is essentially brain tissue, to salt, that's what this is, salt, in a neti pot, then the nerves respond to that. Nerve tissue is very delicate. It responds to anything that's trying to invade it, irritate it, or kill it. So you'll have a stinging sensation. But again, this neti pot's really mild. And the salt that you put in your chlorinated bottled water, or your bottled water, is supposed to equalize the pH and the salinity, make it nice and comfortable. So it is an important thing to wash out on a regular basis. Now, if you don't like doing the neti pot like this, and then on the other side, or you don't like that idea, a lot of people say, it makes me feel like I'm drowning. Then you can get a spray. I don't have a spray, but there's a saline spray called Simply Saline. It's an aerosolized can about this big. So if this is a bottle of salt, sea salt, it's about this big, usually red and white, and just spray the nozzle. You touch the nozzle, and a gentle spritz comes into your nose. It doesn't go that far. It'll probably go up to about the second or third, but it's really gentle. And for kids, it's the salinity is different. And I think it also is oily. So it helps to rinse out some of the stuff that you've been inhaling all day and get that out of the contact of the delicate mucous membrane, so you don't have a reaction to it the next day. So those of you who say inhale dust or paper, especially if you have shredders in the office or warehouse dust all day long, you might not be bothered by it, but your partner's gonna be bothered by it, because this will cause a lot of snoring if you have swelling and you try to go to sleep, or if you have a beer too, which we'll get to in a second. So rinsing your nose twice a day is an important thing. Neti pot, Simply Saline, the neti meds, this big contraption you're putting in your nose, that too will work. It is kind of gross, but can you imagine all that dried snot? There is dried snot. If you've ever done this, you can see all the watered or rehydrated snot come out, and you don't get that out with just dry blowing with a tissue. So, and when it doesn't come out, it has a big ball of snot somewhere that's dry, it causes an allergic reaction to the rest of the mucous membrane, and it causes you to get swollen and stuffy. And then it causes the asthma to turn on very easily. So you got to be careful. I think it's easy. And there's no downside to rinsing your nose. You can't overdose on it. Sometimes I'll say, try to chase the nasal neti pot with nasal cromolyn sodium. So this followed by this. Obviously, you got to get out all the water. But nasal crom is a great over-the-counter antihistamine. Stabilizes mast cells. Used to be prescription. Now it's over-the-counter. I can't find this anywhere. I got to get this on Amazon. So, especially allergy season, I think twice to 3 times a day is a nice rhythm with this after rinsing out your nose. So, we talked about allergic type reactions. Now, inflammation. Now, even if you live in a very clean environment, and maybe that's possible, you can still have inflammation just from the dryness of the air. So if you go from humidified air in a nice warm house to super cold and dry windy air outside, the delicate lining of the nose reacts to that by protecting. It doesn't want to freeze or dry excessively, so the brain sends a whole bunch of fluids in here to get the nasal mucosa nice and swollen. Kind of like your eyes. If your eyes are exposed to dry, cold air, they'll tear up by reaction to protect the lining so it doesn't dry up and scratch. Same thing happens with dry air. Whether it's that or you just get into a car and it's blowing dry air in your nose, in your face, that's irritating to the eyes and the nose. That's called vasomotor rhinitis, for which, again, irrigation, sometimes oil will be helpful to put in the nose. That's kind of weird. Or everybody likes Flonase. I think Flonase is a nice preventative. That's a steroid in my nose. So kind of like this, but prescription. I think there's also over the counter. The Flonase or the nasal quartz, those are good. I think they're preventative, but you don't just spray this on your nose. If you don't rinse the nose first, you just sprayed it on your dust and your dried snot. You got to rinse off that stuff. Like if I'm going to write something on this board, I want to erase the whole board first, then write something new. Well, if I'm going to spray on medication, which it is medication, you want to rinse all that crap off from the whole day, whether it's a pet. Even poodles can be termed hypoallergenic, but still they poop outside and they bring in all the stuff from outside inside or onto your bed. So unless you wipe down that dog 2 to 3 times a day and wipe his paws down, he's bringing stuff into your bed. You got to rinse your nose, especially if the dog's with you all day. If cats, no question, you got to rinse your nose, especially if they're in the bed. So rinse the nose out, put in the steroid, whether it's Flonase or nasal quart. There's other ones that are out there that are generic. And hopefully you keep out of developing too much of an inflammatory reaction. Now, if it doesn't work, then there's nasal sprays that are prescription. Astelin is one I can think of. It's an antihistamine, so it sprays right into the nose. It delivers the antihistamine that'll calm down the bite, like Claritin, almost same as Claritin. It also takes care of swelling. 2 for 1. So it's pretty good. I've used that before, but I'm sensitive to medicines. It makes me sleepy when I use it. So does Claritin, for that matter. But if I'm suffering, I got to use it. So that's the inflammatory or vasomotor rhinitis that causes headache and facial pain. That's the allergic that causes headache and facial pain and runny nose and itchy eyes. Then there's also infection. So if these guys can't drain out on a daily basis, think of it as having a menstruation. You got to clean out the lining of the uterus before trying to implant another baby. Well, if these guys don't clean out and you just accumulate damage and swelling, you'll have a fluid level. The fluid level in here will be a pool for bacteria to just multiply in. It's like a petri dish. So that's when we see that there's pain. Again, there's pain to the face, pain on one side, maybe both sides. It doesn't have to be a textbook, but you'll have the typical onset of migraine or headache. And if you have nasal discharge that didn't screen, then it's obvious. But if you don't have the discharge able to come out, you're not going to have anything. You might just have a need to do that, or just pounding right here. Well, opening up the nasal passage by cleaning up with saline would be important to get flow going. Then sometimes the nasal sprays will decrease the swelling enough for the sinuses to be able to drain out. Sometimes in the worst cases, you'll need to be on steroids, oral steroids, to bring down all the swelling suddenly. Once you bring down the swelling, the passages will flow, and then all the bacteria will just leave naturally. That's the way you're supposed to take care of like a urinary tract infection is, pee the bacteria out. But some people don't like to wait, so they like to be on antibiotics. And that's fine. Same thing with the sinuses. If you can get things flowing, you'll be fine, but some people feel better when they have antibiotics, and that's okay too, especially if you're suffering. I've been through headaches. Fibromyalgia, this trigger point right here, causes when it's flared up, and thank God it hasn't been flared up in a while. It's not wood, but it doesn't matter. It brings pain over to the front and gives me a headache, one-sided, which I used to think was migraines, but it's not migraines, it's fibro. Thank you, fibro. So that would be an infection. So infections, I sometimes treat with herbals. You can do antibiotics after you get moving with the swelling down, with the rinsing, and the steroids maybe. I like things like butterbur. Actually, I have it here. Butterbur, that's an herb that helps with headaches, but it also helps with decreasing nasal swelling. It's great for inflammation, I think. Butterbur, usually 75 milligrams of PA-free butterbur twice a day. While we're at it, there's also, well, we'll talk about that in a second. So that's a great antihistamine, anti-inflammatory, and I think an antibiotic, but twice a day ain't gonna hurt. And there's no downsides with butterbur. Now you have to get PA-free because in the distant past, butterbur used to cause a problem, but when you have it PA-free, it's most of the products out there are PA-free. So I like Now Foods products. So that essentially is it as far as sinus possibilities. And you don't have to follow the rules. It can be one side, it can be both sides, it can be up, it can be lower. If it is lower, you always want to worry about teeth though. Sometimes these teeth can be a problem and be the root cause. Get it? Root cause? Root cause of a sinus infection. These teeth, the teeth are here, but the roots extend into the base of the sinus. So if you have big enough apical abscess to the upper molars or the upper incisors, it'll cause irritation. And if you don't take the tooth out, or if there's a root canal in there and there's metal and it's irritating the sinus, or it wasn't done properly, like there's still infection left over and somebody just covered it up, you're going to have persistent headache. Sometimes getting a Panorex view or going to a holistic dentist would be important. But if you don't get anywhere with sinus, try to look at the teeth as a possibility. So next we'll talk about muscular. Muscular headaches can be, usually they're both sides. It's described typically as wearing a cap. You'll have pain around the circle of the head or the scalp. That's typical, but doesn't have to be. But if you have that, it's more tension or muscular. There are muscles here, temporalis, the frontalis, the occiput, that all can contract, just like a Charlie horse, a calf spasm. And when the muscles contract, say you're wearing a band that's too tight, like a headband or a cap, too tight, it's going to cause chronic irritation to the muscle. The muscle is going to want to move, but it's going to be held down. It's going to cause pain after a while. Sometimes if you just are trying to read like this, like I do sometimes, you have to go like this. You have to flex your frontalis muscle. Or you have to shade from sun. And that will cause you to use this frontalis muscle. This frontalis muscle is right here. The frontalis muscle, through a connection called an aponeurosis, is connected to the occiput. And the occipitalis muscle back here is connected to all these tiny neck muscles. There's a whole bunch of tiny ones. Semispinalis. Well, anyway, I like to stick a needle. That's why I put an arrow right here. I like to stick a needle right in here, and there's a point that really makes headaches go away. It's a little spooky because there's a lot of meat back there, but if you can get the point properly, and you don't have to go deep, an acupuncturist doesn't have to go deep, but if you get to the point properly, it takes care of frontal headache really nicely. Or you just get a massage. If you've ever had a scalp massage and the massage therapist starts to massage back here, really nice relaxation, gets you to just relax this everything up here, aponeurosis, the frontalis, and that might be a successful relaxation. And if you can't get relief with that, then ice packs will help. Usually 15 minutes, like a muscle cramp to the calf, or a Charlie horse anywhere else, muscle cramp anywhere else. 10 to 15 minutes of ice therapy straight without hurting the skin usually freezes up the muscle, it decreases the nerve ending sensation, and it calms down the muscle to not spasm anymore. If when it doesn't spasm, then it loosens up. If it loosens up, no more trigger point. So chiropractors also help with regards to alignment issues. Sometimes the alignment issue will cause chronic tension to all these tiny muscles back here. You have to get to a good chiropractor. It's unusual to get adjusted. Before I went into the Spartan run, I had a flare-up of my fibro. Alan Getz down in South Elgin got me taken care of, and I was able to continue. I haven't been to him in a while. Again, knock on wood, I haven't had any hiccups or speed bumps, so we'll see how things go. But he's always there for me if I need him. So those are usually the muscular things. The typical things for muscular rescue would be anti-inflammatories or Tylenol. I think they're pretty decent. As far as topical, definitely. Whether you do medical marijuana CBD dominant or hemp-based oil CBD, or hemp or medical marijuana with a high CBD, low THC orally, I think those are all good. Essential oils. Eucalyptus is good. Peppermint is great. I kind of like helichrysum. That's my favorite. Panaway. Panaway by Young Living. It has wintergreen in it and helichrysum together. And I think a little blue spruce as well. But you can pick your essential oil depending on your aromatherapist picking it out for you or helping you pick it out. But rubbing it to the sides would be great. So aromatherapy, ice therapy, acupuncture, massage therapy, all are beautiful things for muscle. And then getting your eyes checked in case you're one of these guys. So I might as well go straight to the eyes. We'll pass by the migraines for a second. Visual problems can sometimes cause one-sided pain. Usually it's one-sided pain like this. That could be a refraction issue where you're going like this, but usually it's two sides, or a pressure problem like glaucoma. So you should always get your eyes checked up, but I don't usually see patients for visual problems. Usually the first two things are the biggest things. So get to an eye doctor or an optometrist, and they should be able to check pressures, take a picture of your retina, make sure that there's no blockage. Worst case scenario would be that you are having a problem with retinal artery occlusion. That's very rare, but even an optometrist can take a nice picture computerized nowadays. Next would be migraines. Migraines are terrible. So the migraines have this prodrome where about 30 minutes before the migraine hits, you'll have ache, and something weird, and then suddenly it slams you. Terrible pain, usually one-sided, behind the eye, gets to the point where you have to turn off the lights, like looking at this light. I'd probably have a headache if I was a migraine sufferer. Or hearing loud music or not getting good sleep, all that stuff is important for tipping you over into a migraine attack. People that have migraines try to avoid that. But they have been able to find, medicine has been able to find ergotamines. That works well with making the blood vessels stay tight. The only problem is there's a lot of danger with ergotamines with pregnancy, so they've come up with triptans like Imitrex or Relpax. Those are fast acting. All these things do, if you look at what a migraine does, this is a blood vessel, right? Cross section of blood vessel. There's a bunch of blood vessels. This is the heart, this is the carotid, and these are the blood vessels that kind of course their way through the brain. And a blood vessel in cross section is just circular, and it's all muscular. But the problem is, as the blood vessel opens up, pop! That's what happens. It tries to dilate, and then when it gets to that point, it tries to fight the dilation, but when it gets to that point, it squeezes brain tissue around it. Brain tissue, like I told you before, from these guys does not like to be messed around with. So when that blood vessel increases in size, even a small thousandth of a millimeter, it'll still press on the brain tissue. Brain tissue will say, I don't like that, I'm giving you a headache. Just as a check engine like to say, hey, there's something going on up here. So usually the easiest thing to do is you've been ruled out for stroke, bleed, any kind of malformation. Sometimes they'll do that in an emergency room. Usually don't do that in an immediate care center. They'll give you a triptans like Imitrex. Sometimes an Imitrex shot will take away pain immediately. So what the Imitrex shot do is the triptan does this. It closes it down and secures it into a small again. No pressure, no pain. And usually that locks it in. So if you know you have migraines, then there are abortives like the triptans that abort the pain. You can only use anti-inflammatories like Aleve, Advil, Motrin, ibuprofen, naproxen, or Tylenol. They both work well for controlling pain, but sometimes you'll have to go to the big guys. And if you keep on having them over and over again, you really should be on a preventative. That's usually a beta blocker. Metoprolol is a common beta blocker, but I think really you got to try with your migraine suffering to avoid all these foods. And here's the bad part, because the foods that cause migraines to come out are all the fun foods. This is essentially what you eat in a dorm, if you're a fraternity brother, or a sorority probably. So alcohol is what you have on Friday and Saturday night. Not good if you have migraines. It's either the tannins in red wine or the tyramine in beer will cause headaches. So alcohol is a no-no. And then the caffeine the next day is a no-no. Now, some of you rescue yourselves with caffeine, but that's good temporarily, but it actually brings on headaches as well. So chronic use of caffeine will cause it. I didn't put anything here, but sometimes chronic use of pain control medicines will also cause a headache to come out. Norco, morphine, Vicodin, hydrocodone, tramadol sometimes can do it. So when you use it to rescue you, but you get used to using it every day, you'll have actually a withdrawal, a desensitization, and the migraine will hit even through that. You try to eat more, but it won't work, so you'll have to have a higher than normal dose. It's a bad cycle. And I think that's one of the reasons the opioids are not that great. But, if you're in pain, you want to get rescued. Cheese, especially aged cheese, is a no-no. So alcohol and cheese is a no-no. Nitrites, processed meats, which we usually have after or during the fraternity party, a no-no. MSG, which is usually what we eat after a fraternity party if you go to the Chinese place, because Chinese food is typically loaded with MSG. MSG is a preservative, but it's also, you have to be careful, it can be in a lot of things nowadays. It can be hidden as hydrolyzed fat, hydrolyzed protein, or all natural preservatives. So be careful what you have. You can usually, if you go to a Chinese restaurant, ask no MSG, please. And then they'll just put salt. But salt sometimes screws you up too. To artificial sweetener, So you guys that are trying to get off of the Cokes and you're using aspartame or any of the artificial sweeteners, really. Sugar is not a good thing either. But any of the artificial sweeteners, although it doesn't have any calories and doesn't cause an insulin response, it can cause headaches. So unfortunately, that's bad too. So the coffee's out, so is the artificial sweetener. And then foods. There are some people who are super sensitive to eggs, tomato, onion, dairy, wheat, sometimes citrus. But that's knocking out so much. You probably should have an food allergy test and an environmental allergy test first to really localize what we're doing here. Very expensive to have those tests done, but give you a world of information. So that would be migraines. You know your rescues. Worst case scenario though is you got to make sure the brain isn't having any problems. The brain could be from increased pressure. So inside the brain you have fluid, and sometimes fluid gets supposed to circulate out back into the lymph and back into the heart. But sometimes if the fluid is being made too fast and it can't leave via the doorway out, you'll have increased pressure from it's called hydrocephalus. Not a good thing. It doesn't usually happen, but it can. So something to consider. But that's usually MRI quality. You got to get to the emergency room. Tumor can be there. That's where a CT or an MRI might be more successful. CT scans sometimes will pick up large tumors or cancers. MRIs would be the most sensitive. And there's also food withdrawal. And we already talked about the foods. I don't like carbohydrates. Some of the waxing and waning of carbohydrates will cause you insulin dumping, and that can cause a headache. So will carb cravings. So those of you who are trying keto, and I will be get on that alarm button because I'm going to be doing a video on keto very soon. But when people are trying to withdraw from the sugar and artificial sweetener, they need something. I usually say embrace fat. Fat bombs, keto practice. I think it's helpful. Give you an energy source, give you a different taste of something sweet instead of the sugar that really is unhealthy. Sugar breaks down into glucose and fructose. Artificial sweeteners don't break down into anything, but they also get into the colon and they screw up your microbiome. So anyway, I always say that you always have to be careful about having headaches react to your withdrawal. And if I tell you this, that all these are to be stopped, you'll probably have a withdrawal from all this stuff. So for 2 to 3 days, expect headaches. To get on your Tylenol, get on your anti-inflammatories, maybe load up ahead of time with butterbur. And the other things I like to do too, vitamin B2 at 400 milligrams twice a day, very good. These two are my favorite, butterbur and B2. I think they work great. There's no overdose. B2 you can't overdose on. It's a B complex. Butterbur you can't overdose on. This is an herb and this is a synthetic man-made. CoQ10 at 100 milligrams 3 times a day has been shown in some people to help, but CoQ10 in good quality is very expensive. Feverfew is pretty decent. I haven't had any great results with it, but some people take 100 milligrams a day and have good results. Acupuncture. So if you can get to a good acupuncturist or an acupressure practitioner, that would be awesome. That'll usually turn it away great. So when I was first diagnosed with fibromyalgia in about 2005 or so, when I left Central DuPage Hospital for being told I wasn't a good quality doctor, I had all the headaches, and I went going through I needed narcotics to get rid of the pain. That's why I moved away and stopped medicine for a while. But I got over it. I got my groove back. I felt reason to practice medicine again because I believed something that wasn't really true. And I came back, all because of my patience. But either way, I was able to beat the fibro, get back into medicine. I've got this thing under control now, but I can tell when it's coming back. When it's coming back, I just put the needles in myself. So I'm an acupuncturist from UCLA, and I follow the Joseph Helms technique. I also follow the Joseph Tan technique. So I can always pull them out. I do them selectively, but I just don't have any time in my regular practice to do it. I have other acupuncturists that I like to refer to, so put a comment down below. I'll see if I can find you a good search database. So once you rule out all this stuff, hopefully you have the headache done and gone. Again, these two, my favorite things, there's no problems with using this chronically. Neti pot, there's no problem with using this chronically. Nasal crom, no problem with using this chronically. Staying off alcohol and caffeine, no problem chronically. But well, you know, that's gonna. Don't just withdraw. If you're gonna wipe this out, embrace something else. I think telling my folks to just stop, it's a little bit. It's tough because you feel cheated, and I think if you move something out of the way, but you allow something to come in, I think it's more doable, and you'll be praising and maybe finding your way a lot better. So hopefully this gives you, Steve, hopefully this gives you an idea about what to do with migraines. This is a little long for a minute clinic, but I think we got through this. Don't forget to leave comments and see my other video on stuffy nose. Otherwise, I'll see you next time in the clinic.